Good afternoon. County Executive Rich Fitzgerald here with Dr. Deborah Bogan from the Allegheny County Health Department giving our regular briefing on COVID-19. This will be our last briefing for the year. And as we enter into the holiday season, Christmas and New Year's, we know a whole lot of people are going to be getting together, and again, we want people to be as safe as possible. I want to thank the over 900,000 people that have already been vaccinated here in Allegheny County. I think it's 912,000 as of today's report. That's really tremendous effort for folks, but we still have about 300,000 people in Allegheny County that haven't been vaccinated. And for those that are being vaccinated and getting the booster, we know they're going to be safer. Dr. Bogan's going to go through some numbers, and we'll repeat some of those numbers, but so much more effective and not being hospitalized, obviously not being fatal when you have that vaccine. And also, as we know, with the Omicron spreading and the type of spread that it has, the studies show it's even more spreadable, if that's the right word, than Delta. Luckily, it doesn't seem to be as virulent, but it's still more spreadable. So, when you're indoors with a lot of other people, in the spirit of the holidays, please wear your mask to protect from spreading, because we know even if you're vaccinated, you can be spreading the virus onto someone who might have immuno issues or even be unvaccinated. So anyway, I also want to thank all of the county employees who have worked so diligently this year. Obviously, Dr. Bogan and her team with the health department, making sure testing and vaccinations and boosters and all the things going out into the community, out into our senior buildings and some of our underserved communities, making sure that happens. But also the county employees who by December 1st needed to be vaccinated. Most had already done so anyway. And as we announced last night at the council meeting, less than 2% of the employees ultimately decided not to do that. I think it was about 1.4, 1.5%. So the folks that you are being served by the public and working with their coworkers are vaccinated and protecting each other. So let me turn it over to Dr. Bogan to give her report and the update on where we are. Dr. Bogan.
Thank you, County Executive. Good afternoon. Thank you all for joining us today for our last COVID-19 briefing of 2021. We have lots of topics to discuss today, so I'll jump right in with the numbers. In Allegheny County, our case counts remain stable but high, around 600 cases a day. PCR positivity rates also remain high at around 11.4%. Hospitalizations remain high, as do deaths. In addition to 177 COVID-related deaths in October and 139 in November, so far in December, we have already 97 deaths. Sadly, I don't see these numbers improving anytime soon, and here's why. Omicron is highly contagious and is causing daily cases to rapidly increase in parts of the country and the world. According to the CDC Nowcast, Omicron is now the most common coronavirus variant in the country, including in Region 3, which includes Pennsylvania. The eastern side of Pennsylvania is already seeing an Omicron surge, and although we don't have any confirmed case reports of Omicron here yet, we do have evidence of small amounts of Omicron variant in our wastewater samples. I expect we will see a rapid rise in Omicron variant in our county in the coming days to weeks. How Omicron will affect our lives here is not entirely clear yet. This is a new variant, and we're still learning a lot about it, but this much is very clear. Getting vaccinated with one of the mRNA vaccines and a booster dose is the single best way to protect yourself and your loved ones and anyone else you come in contact with from the virus. We know that people who are fully vaccinated can and will get COVID, but those who are not fully vaccinated experience far more serious infections. Hospitals across the country, the state, the region, everywhere, all report that the majority of people who are hospitalized or die from COVID are people who are not fully vaccinated. Here in Allegheny County, so far in December, unvaccinated people in their 30s were 12 times more likely to be hospitalized for COVID than their vaccinated peers. There were 18 deaths among people ages 30 to 59, All of them were unvaccinated. These deaths are as tragic as they are unnecessary and premature. And it breaks my heart to see people die because of misinformation, to see them refuse life-saving therapy. The vaccines work and are doing their jobs. The second most important tool in the battle against COVID and this new variant right now is masking. And I'll illustrate its effectiveness with some simple math. Let's say wearing a properly fitted mask reduces transmission by 50%, which is a safe estimate. Let's assume that every person infected with the Omicron variant without masking or mitigation strategies is likely to affect 4 other people. If you do the math, those 4 will infect 16, those 16 will infect 64, and so on. After 10 iterations, you're left with just over 1 million cases. But if masking reduces spread by 50%, that is, 1 person will only infect 2 people, not 4. Those 2 people will infect 4, and those 4 will infect 8, and so on. By the 10th iteration, we are just over 1,000 cases, a mere fraction of the cases following 10 iterations among people who are unmasked. Furthermore, say the Omicron virus causes 10% of people who get it to become seriously ill. In the first example, with no masking and over 1 million cases, over 10,000 people will become seriously ill. But in the second case, with masking and only about 1,000 cases, only 10 people will become seriously ill. I hope this example explains why I urge everyone to follow the CDC guidance to mask up when inside in public settings, regardless of your vaccine status. This is especially important with the Omicron variant. I've heard from those who insist we must need a mask mandate and from others who argue for the exact opposite. This is the story of our divided country right now. This is about individual and collective responsibility, and the simple fact is that masks reduce transmission of the virus, and you don't need a mask mandate to do the right thing. I wear a mask regularly, even though I'm healthy, fully vaccinated, and boosted. As we said many months ago, my mask protects you, and your mask protects me. We are all in this together. We truly are. And wearing a mask is a simple and easy way to protect us all. I understand people are frustrated. I hear from residents and see news articles about COVID fatigue and confusion and anger over why our lives have not returned to normal, despite wide availability of vaccines. No one is to blame here. This is virology in action. Variants are naturally occurring changes in viruses. Think about the flu virus. It changes so often that we need to get new flu vaccines every year. As long as COVID-19 spreads, we can expect new changes and new variants, and the best protection is to get vaccinated and boosted. And if you're wondering why a booster is necessary, it's because over time, vaccine protection wanes. So when doctors and scientists recommend getting a booster, it doesn't mean that the vaccines aren't working. They are, but boosters help us maintain high levels of protection over longer periods of time. And remember, booster doses are common for many vaccines. The bottom line is when the virus changes, our response must change as well. That is science and public health in action. As Isaac Asimov said, the saddest aspect of life right now is that science gathers knowledge faster than society gathers wisdom. On that note, some updates. During our last briefing, I announced that we would be changing the format and frequency of our COVID reports. Starting Tuesday, December 28th, we will move to weekly reports, similar to what the State Department of Health is doing. Day-to-day updates show spikes and variations, but fail to adequately illustrate trends. Weekly reports will allow our staff to provide more data, including reinfections and the number of new cases and deaths among the fully vaccinated and unvaccinated. So, expect a 24-hour update tomorrow, but no updates Friday through Monday for the Christmas weekend. The next update will be on Tuesday, December 28th, and will cover data for the entire week of December 20th through 26th. Weekly updates will then be issued every Tuesday thereafter. The dashboard will continue to be updated daily on regular business days. Also, we are changing the way we conduct case investigations and contact tracing. We continue to investigate all outbreaks, We continue to investigate cases among people 50 and older and anyone 4 and younger, and that is the age group for which there is not yet an approved vaccine. In all other cases, people who test positive will not be contacted by the health department. People can access information from online resources, call their own healthcare provider, or call 211. We made these changes because we've been at this for nearly 2 years. Fewer people respond to our calls, and many people are now conducting tests at home, and therefore we don't have that information about their results. The health department at this time has maintained staffing to conduct about 200 investigations a day, and these changes we're making will ensure that we reach our highest risk groups. With that, I wish everyone a very happy holiday, and I remind you all to be safe and be kind. I'm happy to take questions.
Sorry about that. The first question that we have is from the Pittsburgh Business Times. It looks like there is an ever so slight decrease in hospitalizations in Allegheny County. Talking to docs today and over the past week, does Dr. Bogan see that in the data?
Yeah, we have been seeing, I think hospitalizations peaked in late November, early December, and there's been a slight decline, but not a large decline, so our numbers still remain high. And of course, I'm concerned that what we'll see going forward when Omicron becomes more common here as well.
This next question is from the Post-Gazette. Is there any thought being given to requiring masks, proof of vaccination, limits on attendance or seating for restaurants and sports and entertainment venues, or other indoor spaces as being done in other large cities?
I think the county executive will answer that.
What we're seeing right now is an awful lot of organizations, companies, entertainment venues, restaurants, et cetera, are putting in place policies that they feel are best for them, whether it be masking, whether it be showing vaccine cards if you go in, those type of things. Many employers now are requiring it as a condition of employment, so I think you're going to see more and more of that as time goes on. At this time, I think Dr. Bogan covered it in her remarks. You've got some people that would love to see that happen, and you've got as many people on the other side saying, well, they don't want any parts of it. So I think, as we go through this holiday season over the next few weeks, with New Year's, Christmas, et cetera, families getting together, and various holiday gatherings, et cetera, just people to be respectful and responsible. We know that if you are masked, if you're vaccinated, you're 1/5 as likely to spread it as somebody who's unvaccinated. And if you're boosted, you're 1/10 as likely to pass it on. So we want to make sure that obviously people get vaccinated, and the vaccines are very, very readily available throughout the county, but also in certain circumstances, as Dr. Bogan said, please be responsible, care about others, and wear your mask.
This next question is from the Pittsburgh Business Times. I believe that you have partially answered it in your remarks, but would ask if you would mind expanding on it a little bit. Are there any confirmed cases of Omicron yet in the county?
Of Omicron? Yeah, so we do not have any confirmed cases, meaning cases where the virus has been sequenced from a case, from a test at this time. Again, there are, if you look at across the state as a whole, there are cases in other parts of the state. However, we have started to monitor our wastewater samples in our community. We've been working on that for the last month and a half or so, and we're starting to look at that data, and we do see some evidence of Omicron in some of our wastewater samples. So I know this is the first you're all hearing about this. I'm excited to be able to share this data with you as it becomes, as we gather more information, and we will be putting out some information about that in the beginning of the new year.
This next question is from the Post-Gazette. Is the county thinking of setting up any kind of mass testing site or program, as was done at the beginning of the pandemic, since home testing kits are hard to find and the federal program hasn't rolled out yet?
Yeah, so testing, we have been aware of the need for testing for a long time, and we really expanded our testing here in the county over the last 2 months. We've been working with the company Curative, who we've worked with now for, since I think April of last year. So with working with Curative, we've expanded our sites, both our permanent sites. We now have at least 4 sites that are open. Many of them are open 7 days a week. We also have increased the mobile testing that they're doing. We put maps up and send out that information pretty broadly. And just yesterday, they did over 2,700 tests in Allegheny County. That was the highest they've done in any one day. And they're going to continue to expand as we need help with that. So that's been great. I also want to let people know that we want to make sure that people know they can call to get an appointment. So most of the scheduling for the curative tests are done online, using an online, very simple online process. But if you do need help scheduling, you don't have access to the internet, you can call 888-702-9042 to schedule a test through one of our curative sites in the county. And that line is available both in English and Spanish. So I'm going to give that number just in case. Again, we prefer you do online registration, but if you can't do online registration, you can call Curative at 888-702-9042. And again, you can also call 211 if you need help with questions. So we were anticipating a need for more tests in the county, and we've expanded our services and our access here already, and will continue to be responsive to needs.
This next question is from WESA. As we approach Christmas and New Year's, what concerns you most in terms of COVID-19?
I guess it would be the spread of the Omicron and what will happen when it arrives here. It's a highly contagious form of the virus. It spreads quickly, and so all I can say is please, when you're out in public, you're in crowded places, wear your mask. It protects you, it protects everyone else, and it will reduce the number of cases we have in our county if everyone will put on a mask voluntarily and wear them properly.
Also from WESA, are you concerned that hospitals in Allegheny County might have to enact crisis standards of care?
I feel like I answered this question a lot. So our hospitals, we have a very robust and flexible hospital system here in Allegheny County. We're very fortunate. The hospitals can respond to you about what they would need to do for that. But again, they have a lot of capacity to expand and make decisions to expand as needed. So I'm going to refer you back to the hospitals, but just to say I have every confidence in them to manage this situation well.
And while not a COVID question, in the past you've first spoken about flu numbers during the update. So can you give us an update on flu numbers in the county?
Sure, and I want to remind you that we do update the data on our health department website every week for flu, starting from the beginning of flu season all the way through the end. So as of December 11th, we've had over 1,000 cases, about 1,016 cases so far. Those are confirmed cases or probable cases, but they're tested. So not everyone who's sick gets tested, so we don't know about all the cases. So at least 1,000 cases. We know of 5 hospitalizations and 1 death so far this year.
And in the last 3 months, can you tell us how many Allegheny County residents in their 20s, 30s, and 40s have died from COVID-19?
I don't have that data at the tip of my fingers right now. Some of that data are available on our website, or we can try to provide it for you after the briefing.
This next question is from Kitty K. I believe that you actually already answered it, so I'm going to skip it now that I read it, so I apologize. But the last question from Kitty K is, when we hear that this is the dominant strand across the country, what does that mean for us when we're talking about the Omicron variant?
So again, the CDC, when they report the data, they do it by region. And we are in region 3. And so it means that in our region, it's reporting that the cases that are being sequenced, and not all cases are sequenced, that means that most of them, or in this case, about 75%, have our Omicron variant already. In Allegheny County, we haven't had a single case yet where it's been sequenced, but we're following it closely because we know it's just a matter of days till that happens. And in other places, once you get Omicron into your community, it becomes the predominant strain very, very quickly. And so that's what we're watching for here. I don't think it would be any different here than it's been in other communities. So that's what we're looking for.
And that was the final question, if there are any closing remarks.
I just want to also, like our county executive, thank all of the staff of the health department who have worked tirelessly since March of 2020. It's been a long year 2020 and 2021, and I want to thank you all for your hard work and efforts, and I hope you all get some time off over the holidays and have a restful and peaceful holiday. Thank you.
Let me echo Dr. Bogan's remarks, and I want to thank them for really their diligence and their dedication over these last 2 years. It's been a long 2 years. We know we're not done yet, as Dr. Bogan said, these surges and cycles. Just when you think things are, slowing down, then there's another variant that comes around, a mutation, as medical experts have actually predicted since the very beginning. It really does remain all of us to be vigilant and stay tuned to the information that Dr. Bogan and the CDC and others are giving regarding vaccines, boosters, all the type of things that go on. We mentioned earlier on, this is a time of the year when we get with our families and obviously care about our community and our families, to know that if you're vaccinated, you're 1/5 as likely to pass that on, even if you never have any symptoms, but have a breakthrough case, and 1/10 as likely to pass it on if you are boosted. And then the other numbers that are the most stark is that if you have a vaccine, you're 1/14 as likely to succumb, to die of it, and if you're boosted, 1/20 as likely. So you're 20 times more likely to die if you're unvaccinated and unboosted. So we really do encourage folks. We're very fortunate. Again, there's 75% or so of the county residents have been vaccinated, and most of them with both shots and many with boosters. We really encourage you, if you have been vaccinated, encourage your family members, your friends, your coworkers, folks in your community to get that vaccine and protect themselves and protect everybody else in the community. We do wish everybody over these next couple of weeks a lot of restful, peaceful time. Wish everybody a Merry Christmas, a Happy Holidays, a Happy New Year. We will be back again working on it, and we'll continue to work on it throughout the holiday season, and then the next briefing will be after the first of the year. Bye.
Our next regularly scheduled briefing is Wednesday, January 5th at 4 p.m. Thank you for joining us.